Hello and welcome, seniors. Today we're talking about something that might shock you. The way you've been brushing your teeth your entire life could be increasing your risk of dementia. I'm Joseph Larison, and what I'm about to share could change not just your oral health but potentially your brain health as well. Now, I know what you're thinking. How could something as simple as brushing my teeth possibly be connected to dementia? It sounds far-fetched, but groundbreaking research over the last decade has uncovered a compelling and concerning link between gum disease and Alzheimer's disease, a connection that should make all of us reconsider our daily oral hygiene routines. Consider this. According to the CDC, nearly half of adults over 30 have some form of periodontal disease. That's about 64 million Americans walking around with a condition that research now suggests could significantly increase their risk of cognitive decline later in life. Even more alarming, a landmark 2019 study published in Science Advances found that the bacteria responsible for causing gum disease, Porphyromonas gingivalis, was discovered in the brains of Alzheimer's patients. Not only was it present, but the researchers also found that this same bacteria can produce toxins that destroy brain neurons. Today, I'll explain exactly how your brushing technique could be leaving you vulnerable to this bacteria, the specific mechanisms that link gum disease to brain health, and most importantly, the correct way to brush to help protect both your teeth and your brain. This isn't about scaring you. It's about empowering you with information that could make a profound difference in your health journey. So let's dive into the mouth-brain connection that everyone should know about. Before we talk about proper brushing techniques, it's essential to understand why this matters so much. The connection between your mouth and your brain is more direct and significant than scientists ever realized. At the center of this connection is a bacterium called Porphyromonas gingivalis, or P. gingivalis for short. This is not just any ordinary mouth bacteria, it's the primary pathogen responsible for chronic periodontitis, the most severe form of gum disease. What makes P. gingivalis particularly problematic is its persistence and its weapons. This bacterium produces toxic enzymes called gingipanes that destroy gum tissue. These same toxins have now been found in the brains of Alzheimer's patients. You might be wondering, how does a bacterium in your mouth end up in your brain? Scientists have identified several potential pathways. Direct invasion P. gingivalis can enter the bloodstream through bleeding gums, which are common with gum disease, and can directly cross the blood-brain barrier. Inflammatory response. The infection in your gums triggers an immune response that increases inflammation throughout your body, including your brain. Chronic inflammation is a known risk factor for Alzheimer's disease. Nerve pathway. Some research suggests these bacteria may travel along nerve pathways from the mouth to the brain. This isn't speculative science. Multiple studies have found compelling evidence for this connection. A 2020 study in the Journal of Alzheimer's Disease found that gum disease was associated with a six-fold increase in the rate of cognitive decline in Alzheimer's patients. Research from New York University found that gum disease may initiate Alzheimer's disease, with P. gingivalis infection leading to the formation of amyloid plaques, a hallmark of Alzheimer's pathology. A Taiwan-based study of over 9,300 patients found that those who had chronic periodontitis for 10 or more years had a 70% higher risk of developing Alzheimer's disease. Dr. Angela Kamer, a professor of periodontology at New York University, explains, "The mouth is not disconnected from the rest of the body. What happens in your mouth doesn't stay in your mouth. It affects your overall health, including your brain health." This connection means that something as simple as how you brush your teeth could potentially influence your risk of developing one of the most devastating neurological conditions. Now let's look at what most people are doing wrong with their daily brushing routine. Now that we understand the critical importance of proper oral hygiene, let's talk about the brushing mistakes that many of us have been making our entire lives. Mistakes that could leave harmful bacteria thriving in our mouths. One of the most common errors is brushing with too much pressure. Many people believe that scrubbing harder equals cleaner teeth, but the opposite is true. Aggressive brushing can damage your gum tissue, creating entry points for bacteria. Wear away tooth enamel, making teeth more vulnerable to decay. Cause gum recession, exposing tooth roots which lack protective enamel. Dr. Mark Burhani, founder of AskTheDentist.com, notes, "I can tell within seconds of examining a patient whether they're brushing too hard. The damage to gum tissue and enamel is distinctive and widespread among my patients. The second major mistake is using wide, horizontal scrubbing motions across your teeth. This sawing motion misses the crucial area where your teeth meet your gums, fails to clean between teeth where bacteria thrive, can damage gum tissue and contribute to recession. The American Dental Association recommends brushing for 2 full minutes, but studies show the average person brushes for only 45 seconds. When you rush brushing, you miss up to 60% of tooth surfaces. Bacteria-filled plaque remains in your mouth. The protective benefits of fluoride in toothpaste aren't fully realized. Perhaps the most critical mistake in relation to our discussion about dementia is neglecting the gum line, the exact area where harmful P. gingivitis bacteria establish their stronghold. Most people focus on the visible surfaces of their teeth, but the most dangerous bacteria accumulate in the small pocket between your teeth and gums. Failing to clean this area properly allows bacteria to create inflammation, deepen the pocket, leading to periodontitis, enter the bloodstream more easily. Many people brush immediately after eating, especially after consuming acidic foods or drinks. This is actually counterproductive. Acids from food temporarily soften your tooth enamel. If you brush while the enamel is in this weakened state, you can actually damage your teeth. Instead, you should wait at least 30 minutes after eating to brush. Rinse with water after consuming acidic foods. Brush before breakfast rather than immediately after. Dr. Maria Emanuel Ryan, professor of oral biology and pathology at Stony Brook University, explains, many of these brushing mistakes allow the bacteria associated with gum disease to flourish, creating chronic inflammation that's increasingly linked to systemic diseases, including Alzheimer's. These mistakes may seem minor in isolation, but when repeated twice daily for years or decades, they can have significant consequences for both your oral health and potentially your brain health. Now let's look at the correct way to brush. Now that we understand what we've been doing wrong, let's focus on the right way to brush. A method specifically designed to target those harmful bacteria at the gum line while protecting your teeth and gums. Start with the right tools. A soft bristled toothbrush. Medium and hard brushes can damage gums. Fluoride toothpaste with anti-gingivitis properties. Position yourself in front of a mirror where you can clearly see inside your mouth. Ensure adequate lighting to see all areas of your mouth. The most crucial element of proper brushing is positioning your brush at a 45-degree angle to your gums. Hold your brush at this 45-degree angle to your gum line, with the bristles pointing slightly upward for upper teeth and slightly downward for lower teeth. This angle allows the bristles to reach slightly below the gum line where bacteria accumulate. Dr. Timothy Donnelly, a periodontist and clinical professor, emphasizes that 45-degree angle is absolutely critical. It's the only way to disrupt the bacterial biofilm at the gum margin, exactly where P. gingivalis tends to colonize. Instead of scrubbing back and forth, use gentle, circular or small up and down motions, keeping the brush angled toward the gum line. This technique dislodges bacteria without damaging tissue, cleans more effectively below the gum line, reduces the risk of gum recession and enamel wear. To ensure you clean all surfaces, divide your mouth into quadrants: upper right, upper left, lower right, lower left. Spend 30 seconds on each quadrant. Within each quadrant, brush outer surfaces, inner surfaces, and chewing surfaces. Use the tip of your brush for the inside surfaces of front teeth. Use light pressure, only about the weight of an orange. Signs you're using the right pressure. Bristles slightly bend but don't splay out. Gums don't appear white or blanched while brushing. No discomfort during brushing. No bleeding after an initial adjustment period. Bacteria don't just live on your teeth and gums. Your tongue is also a major reservoir. Gently brush your tongue from back to front or use a tongue scraper. This removes bacteria that contribute to bad breath and can travel to your gums. Use a timer to ensure you brush for at least 2 full minutes. Many electric toothbrushes have built-in timers, or you can use a simple phone timer. Dr. Mark Wolf, Dean of the University of Pennsylvania School of Dental Medicine, notes, in studies where we observe people brushing, most think they've been brushing for 2 minutes when it's actually been less than a minute. Those extra seconds make a tremendous difference in plaque removal. By adopting this technique, you're not just cleaning your teeth, you're specifically targeting the bacteria that research has linked to Alzheimer's disease. But proper brushing is just one part of a complete oral hygiene routine that protects your brain. While proper brushing technique is essential, it's only part of a complete oral care routine that helps protect against the bacteria associated with gum disease and potentially Alzheimer's. Let's look at the other critical components. Brushing alone can only reach about 60% of your tooth surfaces. The remaining 40%, primarily between teeth, require flossing. Proper flossing technique. Use about 18 inches of floss, winding most around your middle fingers. Hold 1 to 2 inches tightly between thumbs and forefingers. Guide the floss gently between teeth using a zigzag motion. Curve the floss around each tooth in a C shape, moving it up and down. Go slightly below the gum line, but don't force or snap the floss. Dr. Joan Otomo Corgel, former president of the American Academy of Periodontology, states, "In my decades of practice, I've never seen a patient with perfect gum health who doesn't floss. It's simply impossible to maintain healthy gums without cleaning between teeth. For some people, particularly those with larger spaces between teeth or dental work like bridges, interdental brushes can be more effective than traditional floss. These tiny brushes can be easier to maneuver than traditional floss, are particularly effective for cleaning around implants and bridges, and come in different sizes to fit various spaces between teeth. For those who struggle with traditional flossing, water flossers offer an effective alternative. Clinical studies show that water flossers can remove up to 99.9% of plaque from treated areas, be up to 50% more effective than traditional floss for reducing gingivitis, and reach up to 4 to 5 millimeters below the gum line. Adding an antimicrobial mouthwash to your routine provides additional protection against the bacteria associated with gum disease. Look for mouthwashes containing cetylpyridinium chloride, CPC, essential oils like in Listerine, and chlorhexidine, prescription strength for short-term use. Dr. Maria Ryan explains, antimicrobial mouthwashes can reach areas that brushing and flossing might miss, and they continue working to reduce bacteria for hours after use. Even perfect home care can't eliminate the need for professional dental cleanings. Professional care is crucial because calcified plaque, tartar, can only be removed professionally, early signs of gum disease can be detected and treated, and professional cleaning reaches areas you simply can't access at home. Dr. Stephen Lin, author of The Dental Diet, recommends, think of your dental visit as a brain health checkup too. The state of your gums could be an early warning sign of inflammation that might affect your cognitive health years later. A complete oral care routine incorporating all these elements provides your best defense against the bacteria associated with both gum disease and potentially Alzheimer's disease. But there's more to the story. Your diet and lifestyle choices also play crucial roles. Your brushing technique and oral care routine are foundational, but what you eat and how you live also significantly impact both your oral health and brain health. Let's explore how nutrition and lifestyle factors play into this connection. Inflammation is a common denominator in both gum disease and Alzheimer's. Certain foods have powerful anti-inflammatory properties that benefit both conditions. Top anti-inflammatory foods include fatty fish rich in omega-3s like salmon, mackerel, and sardines, leafy greens such as spinach, kale, and collards, berries, especially blueberries and strawberries, nuts, particularly walnuts, olive oil, and green tea. Dr. Martha Claire Morris, nutritional epidemiologist and creator of the Mind Diet, notes, the same dietary patterns that reduce inflammation and protect brain health also support oral health. It's a powerful synergy. Vitamin C is crucial for gum health and collagen production, which helps maintain the integrity of your gum tissue. Good sources include citrus fruits like oranges and grapefruit, bell peppers, strawberries, kiwi, and broccoli. Studies show that vitamin C deficiency is associated with increased risk of periodontitis, while adequate intake supports gum tissue repair. These nutrients work together to maintain both tooth and bone strength. Sources of vitamin D include sunshine exposure, fatty fish, fortified milk and juices, and egg yolks. Sources of calcium include dairy products, fortified plant milks, leafy greens, and almonds. High blood sugar creates an ideal environment for harmful oral bacteria to thrive and increases inflammation throughout the body, including the brain. To manage blood sugar, limit refined carbohydrates and added sugars, choose whole grains over processed grains, pair carbohydrates with protein or healthy fat, and stay physically active. Dr. Dale Bredesen, author of The End of Alzheimer's, explains, blood sugar dysregulation creates a pro-inflammatory state that affects both the oral microbiome and the brain. Managing glucose levels is protective for both systems. Adequate water intake supports saliva production, your mouth's natural defense system. Saliva washes away food particles, neutralizes acids from bacteria and food, contains enzymes that break down bacterial biofilm, and remineralizes enamel with calcium and phosphate. Both smoking and excessive alcohol consumption significantly increase risk for both gum disease and dementia. Smoking increases periodontitis risk by 2 to 8 times. Heavy alcohol use disrupts oral bacterial balance. Both habits contribute to chronic inflammation and reduce the effectiveness of the immune response. Dr. Barbara Benlin, dementia researcher at the University of Wisconsin, states, "Smoking and heavy drinking create a double hit. They increase risk of gum disease and independently increase risk of cognitive decline. Eliminating these habits provides protection on multiple levels. By aligning your diet and lifestyle with both oral and brain health, you create a powerful synergistic effect that may significantly reduce your risk of both conditions." Now let's talk about what to do if you already have signs of gum disease. If you've been diagnosed with gingivitis or periodontitis or suspect you may have gum disease, it's important to know that intervention can still make a significant difference for both your oral health and potentially your brain health. First, let's identify the signs that you may already have some level of gum disease. Warning signs include red, swollen or tender gums, bleeding when brushing or flossing, receding gums, persistent bad breath, loose teeth or widening spaces between teeth, pus between teeth and gums, and changes in how your teeth fit together when biting. If you notice any of these signs, it's crucial to see a dental professional as soon as possible. Depending on the severity of your gum disease, your dentist or periodontist may recommend, for gingivitis, early stage, professional dental cleaning, improved home care instructions, and more frequent checkups. For early to moderate periodontitis, scaling and root planning, deep cleaning, targeted antimicrobial treatments, and specialized home care protocols. For advanced periodontitis, surgical interventions, tissue regeneration procedures, and ongoing periodontal maintenance. Dr. Paul Eek, epidemiologist with the CDC's Division of Population Health, notes, "The good news is that gum disease is largely treatable at every stage. The earlier the intervention, the better the outcomes for both oral health and potentially reducing related systemic risks." If you have gum disease, your home care routine needs to be more intensive than what we've previously discussed. Your dentist may recommend prescription-strength antimicrobial mouth rinse, higher concentration fluoride toothpaste, more frequent brushing after each meal, daily use of interdental cleaners specifically designed for gum disease, and oral irrigators with antimicrobial solutions. Some supplements show promise for supporting gum health. Coenzyme Q10 has shown benefits for gum inflammation in several studies. Omega-3 fatty acids help reduce inflammation throughout the body. Vitamin D supplementation may improve response to periodontal treatment. Always consult with healthcare providers before starting supplements, especially if you take medications. If you have moderate to severe gum disease, consider discussing cognitive health monitoring with your physician. Steps might include establishing a baseline cognitive assessment, monitoring inflammatory markers, being vigilant about early signs of cognitive changes, and addressing other modifiable risk factors for dementia. Dr. James Noble, neurologist at Columbia University, advises, having gum disease doesn't mean you'll develop dementia, but it does warrant a more proactive approach to brain health, including addressing other risk factors like high blood pressure or blood sugar issues. Emerging research offers hope that treating gum disease may help protect brain health. A 2019 study in Science Advances found that treating P. gingivalis infection in mice reduced the formation of amyloid plaques, suggesting potential benefits beyond oral health. Another study from Taiwan found that patients who had their periodontitis treated had a lower incidence of Alzheimer's disease compared to those who didn't receive treatment. Dr. Angela Kamer of NYU College of Dentistry emphasizes, while we need more clinical trials, the available evidence suggests that managing gum disease should be considered part of a comprehensive strategy for maintaining brain health as we age. By aggressively addressing gum disease, you're not only saving your teeth, you may be protecting your brain as well. Now let's look at specific strategies for different age groups. The approach to protecting both oral and brain health should be tailored to your life stage. Let's look at specific strategies for different age groups. For younger adults, establishing proper habits is crucial for long-term protection. Focus areas include mastering proper brushing and flossing techniques, addressing any existing gingivitis before it progresses, minimizing the impact of high-risk habits like smoking, vaping or excessive alcohol, establishing regular dental checkups as a priority, and managing stress, which can impact both gum health and inflammation. Dr. Lisa Knowles, dentist and health educator, advises, "Your 20s and 30s are when periodontal disease often takes root, even if serious problems don't emerge until later. It's the ideal time to establish habits that will protect both your mouth and your brain for decades." This is when gum disease often accelerates due to hormonal changes, accumulated damage, and increased stress. Focus areas include increasing vigilance as risk naturally rises, addressing hormonal impacts, especially for women during perimenopause, managing stress-related bruxism, teeth grinding, considering more frequent professional cleanings if early signs of gum disease appear, and addressing dry mouth issues that may begin with certain medications. Dr. Mariah Emanuel Ryan notes, "The 40s and 50s are often when we see periodontitis progress more rapidly. This age group needs to be particularly vigilant, as it's also when inflammation-related damage begins accumulating in the brain. For older adults, oral care becomes even more critical as risk factors multiply. Focus areas include adapting techniques for dexterity challenges, addressing dry mouth issues, extremely common due to medications, maintaining diligence even with reduced pain perception, managing challenges with dental work like bridges and dentures, and coordinating dental care with overall health care. Helpful adaptive tools include electric toothbrushes with larger handles, floss holders and interdental brushes, water flossers for those with dexterity issues, and prescription high-fluoride toothpaste to combat root decay. Dr. Janet Yelowitz, former director of geriatric dentistry at the University of Maryland, emphasizes, "For seniors, oral care isn't just about preserving teeth, it's increasingly recognized as an important component of maintaining cognitive health and quality of life. Simple adaptations can make proper care manageable even with physical limitations. For those already experiencing cognitive impairment, oral care presents unique challenges. Strategies include breaking down brushing into simple steps with gentle reminders, using visual cues and demonstration rather than complex instructions, choosing easier-to-manage tools like electric toothbrushes, establishing consistent routines at the same time and place, and seeking professional help for more frequent cleanings and monitoring." Dr. Rita Jablonski, nurse practitioner and researcher specializing in dementia care, notes, "Good oral care is especially crucial for those already experiencing cognitive changes, as poor oral health can exacerbate existing health problems and decrease quality of life. With the right approach, proper care is possible at every cognitive stage. No matter your age, it's never too early to start protecting your brain through proper oral care. And it's never too late to improve your routine and potentially reduce further risk." We've covered a lot of ground today, from the surprising link between gum disease and dementia, to the proper brushing techniques that can help protect both your oral and brain health. Let's summarize the key takeaways and outline specific action steps you can implement today. The evidence linking gum disease and dementia continues to strengthen, with multiple pathways potentially connecting the two: direct bacterial invasion, where P. gingivalis bacteria and their toxic enzymes can travel from infected gums to the brain; inflammatory cascade, where gum infection triggers systemic inflammation that can impact brain health; and shared risk factors, where many factors that increase gum disease risk also increase dementia risk. While research is ongoing, the evidence is compelling enough that taking action to protect your gums appears to be a reasonable strategy for supporting brain health. Evaluate your brushing technique. Switch to a 45-degree angle directed at the gum line. Use gentle circular motions rather than scrubbing. Ensure you're brushing for a full 2 minutes twice daily, and use a soft bristled brush only. Complete your oral care routine. Add daily flossing or interdental cleaning if you're not already doing it. Consider adding an antimicrobial mouthwash, and schedule a dental checkup if you're overdue. Watch for warning signs: bleeding gums when brushing or flossing, red, swollen or tender gums, persistent bad breath, and receding gum line. Support your oral brain health nutritionally. Increase anti-inflammatory foods in your diet. Ensure adequate vitamin C, D, and calcium. Manage blood sugar through diet and exercise, and stay well hydrated. Dr. Dale Bredesen, neurologist and author of The End of Alzheimer's, summarizes it well. Alzheimer's disease is now viewed as a complex, multifactorial condition with many contributors. Addressing oral health and the bacterial burden from periodontal disease represents one important and often overlooked piece of the puzzle. It's important to remember that proper oral care is just one component of a comprehensive approach to reducing dementia risk. Other key factors include regular physical activity, mental stimulation and social engagement, quality sleep, stress management, heart health and blood pressure control, blood sugar management, and avoiding smoking and excessive alcohol. By addressing all these factors, including optimal oral health, you're creating the best possible environment for long-term brain health. The connection between oral health and brain health represents a paradigm shift in how we think about prevention. Something as simple as changing your brushing technique and maintaining proper oral hygiene could potentially have far-reaching effects on your cognitive future. If you found this information valuable, please share it with those you care about. This awareness could make a significant difference in someone's life. And remember, it's never too early to start protecting your brain, and it's never too late to make improvements. Thank you for watching, and here's to your health, both oral and cognitive, for many years to come.